Welcome to everybody joining this Violence, Abuse and Mental Health Network webinar. We are going to just take 2 minutes to allow people to filter in. We do have a lot of attendees today and we want to make sure that everybody hears us from the start. So for those of you here already, thank you, and thank you for your patience while we just wait for everybody else to join. Someone in the chat asking. Welcome everybody to the June Violence, Abuse and Mental Health Network lunchtime webinar. I'm absolutely delighted to be welcoming my colleague Dr. Emma Yapp from the University of Bristol. She'll be talking about normal trauma and abnormal diagnosis, the role of mental health evidence in sexual violence trials. I will hand over to her in just a few minutes. But just to say, if you haven't attended one of our events previously, a special welcome to you. We are the Violence, Abuse and Mental Health Network. We work to reduce the prevalence of mental health problems among children, adults and the elderly by bringing together experts with different ways of thinking about violence, abuse and mental health. Some with personal experience of these issues, some with expertise from the work that they do, and some with both. And through all of our work, we are trying to understand, prevent and reduce the impact of violence and abuse on mental health. One of the really important parts of the work that we do is these webinars. We look across the sector to try and identify research and analysis that we think needs to be gotten out to our members. We ask our speakers to really focus on the findings and implications, so thinking about the real world messaging that is coming from these studies and analyses. So today we have Emma speaking with us. I will say that I know we have a question in the chat already about camera and mics. So this is set up as a webinar rather than as a meeting. So cameras and mics for everybody other than Emma and myself will remain off. If you would like to ask a question, so Emma will be speaking for 20 to 25 minutes, so we make sure we have a good amount of time at the end for a discussion. If you would like to put a question to Emma, and I really would encourage you to make use of the opportunity to do so, please use the Q&A box to do that. I will be checking that as we go, and I will take questions from the Q&A box to put to Emma. Anything that we don't get through, I will send to Emma, and they may or may not be able to get back to you, but fingers crossed that will be a yes. Please use the chat for introductions. It's great for people to use this as an opportunity to get to know one another, and also to share any resources and links. The webinar is recorded, and we will be sharing the recording and a copy of the slides with everybody who signed up for the webinar. So you will be getting both the recording and the slides later. I think that is all of my housekeeping, and it is 12:05, so I'm going to hand over to Emma for their talk. Emma, thank you so much.
Thanks, Sharon. I'm just checking you can hear me okay. Sharon's gone, so I assume you can.
Thank you, Emma.
Okay. But yeah, so hi everyone. Thanks for coming, and thanks for kind of bearing with us as this event was rescheduled. So before I kind of get on to the content of the talk, I thought it might be worth providing a bit of background to kind of me and my work. So as Sean mentioned, I work at the University of Bristol on the Powerful Perpetrators Project, where I'm leading the kind of aspect of that project that looks at doctors' sexual misconduct. But more broadly, my main area of research is about the relationship between sexual violence and mental health. So I used to work at the section of women's mental health with Sean, where I kind of worked on that tangentially, but really it was when I did my PhD at Birkbeck that kind of became my focus. And I should also say here that obviously this talk is going to be discussing sexual violence and mental health, and they are difficult topics. And whilst I kind of avoid producing the most graphic detail in these horrible judgments, I just really encourage you to look after yourselves in whatever way is possible for you. So, you know, if you need to step away from your screen or leave or anything, please do so. Okay, so could I have the next slide, please? Thanks. So there's my PhD. So as I say, it looked at how the relationship between sexual violence and mental health has been understood over time in feminist writing and also in law. And then as well as that, I interviewed people with lived experience of sexual violence and who identified with psychiatric diagnoses. So overall, what that project showed was that we have quite a narrow understanding of the relationship between sexual violence and mental health, which can obscure a whole variety of experiences that don't kind of conform to the norm. And specifically, what I would call a normal response to sexual violence is kind of understood as quite a specific presentation of trauma, and it doesn't necessarily map onto people's individual experiences when they identify with other psychiatric diagnoses. So the next slide, please, just briefly. So a key part of my PhD was concerned with looking at how victim survivor mental health evidence is used in sexual violence trials in England and Wales. And that's what I'm going to be talking about today. For this, as you can see, I analysed case law and legal policies about sexual violence and mental health. But as Sean said, we'll be light touch on the methods and try and get into the findings. So if I could have the next slide, please. Yeah, so just to provide you with a little bit of background to this work, there was one particular legal policy that kind of provided the impetus for my project. So in 2019, which was the year that I started my PhD, there was a wave of media attention that was being given to a pretty outdated legal policy from 2002. The policy recommended that people should not discuss their experiences of sexual violence at all in therapy if they were also being involved in criminal justice proceedings. They shouldn't talk about it at all in therapy before the trial. Now, I suppose that must have been in place to try and prevent then those kind of therapeutic records being used to establish inconsistencies at trial. But it also prevents people from accessing kind of comprehensive and meaningful mental health support in the wake of sexual violence and before a trial, which, as we know, can be quite a long time. But anyway, so in 2019, this sort of whole wave of media attention led to a significant overhaul of all legal policies on sexual violence and mental health between 2019 and 2022. And then last year, new legislation was introduced that aims to restrict the relevance of mental health evidence to sexual violence cases. So if I can have the next slide, please. So while those developments all sound quite positive, I'm afraid my talk will tell a slightly different story. So in the analysis of legal materials that I conducted, mental health evidence was always considered relevant to claims of sexual violence. In particular, there is a very specific presentation of trauma that was associated with successful cases, and almost any deviation from that resulted in victim survivors being branded as psychologically abnormal. And another kind of important thing that I'm going to talk about a bit was that the law has quite a specific understanding of mental health in terms of its impact on memories of sexual violence. So for traumatic memories to be effectively accessed, the law kind of prefers people to be literally placed into a state of trauma again. In contrast, any kind of abnormal mental health is seen to function like a prism of distortion in the same way as a cataract on vision. But in order to make some of these points, it might be useful for me to walk you through a few examples. So if I could have the next slide, actually. Please, thank you. I added things for them to enter, excellent. So providing evidence that people experienced a freeze response to sexual violence was particularly persuasive in the cases that I analysed, and often functioned almost as proof of the violence itself. So, for example, in this case, you can see it on the screen there, a young Polish woman had arrived in the UK without a work permit and needed a way of making money while she waited to get one. So she responded to an advert in a Polish newspaper for cleaning work, which is how she met Navid Soroya, who was subsequently convicted of raping her when she went to collect her first round of wages. And in the appeal judgment, it says, as is on the screen there, she was not physically injured or threatened and needed to explain why she had put up no obvious resistance. So in the original trial, the reason for her lack of obvious resistance was provided as a diagnosis of a conversion disorder, which I think is the next quote, if you can click that through. Thank you. Which meant that she might be abnormally passive in the face of stressful circumstances. Now, although that's not really a psychiatric diagnosis anymore, a conversion disorder was previously categorized under dissociative disorders and was considered associated closely in time with traumatic events. So it's a kind of sort of trauma-associated diagnosis. The conclusion of the judgment is kind of there at the bottom, and it was to the effect that she was not able to fight back as she froze due to a psychiatric illness. So it was kind of decided that she wasn't able to resist due to literally having a trauma-induced illness. And so in this example, a trauma diagnosis, and specifically freezing, kind of functions as evidence of the violence itself. And so to make sense of why the freeze response is so persuasive in sexual violence trials, it's useful to contextualize it within the medico-legal history of sexual violence. So Joanna Burke, who's a British historian and incidentally was one of my PhD supervisors, she did this analysis of psychiatric and legal texts from the 19th and 20th century. And in doing that, she showed that before understandings of trauma kind of arrived in the 1970s, and then they started to be applied to sexual violence. Before that, people were thought to be rendered what was called being physically insensible in response to sexual violence. So legitimate experiences of sexual violence were essentially understood as rendering someone completely physically incapacitated. And there's a quote on the next slide, if we could have that, please. Yeah, great. So she writes that the sensible body was seductive and either invited abuse or would have been able to repulse any attack. The insensible rape victim testified to true violation. So although the language may have changed, the freeze response is kind of remarkably similar to these older understandings of insensibility. In the eyes of the law, becoming completely incapacitated in the face of sexual violence is almost like proof that it happened, that there was a true violation, as Joanna says. And it's certainly true in the cases that I analysed that all of those that were legally successful included evidence testifying to the complainant either being frozen or kind of traumatized more generally. I should also say as a caveat here that I'm not, in no way am I trying to diminish the value of understandings of trauma and the freeze response for people who experience sexual violence and for understanding those experiences. But sort of instead, I suppose, I'm trying to show that the way that mental health evidence is used and sort of taken up in court works to cement some experiences as legitimate and others as not. So yeah, leaving that quote there for a minute, it's important to note that where an insensible and incapacitated body kind of testified to true violation, as she says, a sensible one comes to represent falsity. And this can be sort of usefully illustrated by one particularly detailed case. And again, you know, look after yourselves as we go through this one because it's not very nice. Basically, Edward Gabbai was convicted for sexual violence against multiple people in 2018. But part of the basis for his appeal in 2019, and the one that was ultimately successful, he was acquitted, entailed accessing extensive mental health evidence pertaining to one of the women that he had been convicted of assaulting. And all of these mental health records were accrued before she'd even met Edward Gabbai in December of 2016. And so before she'd met him, she had disclosed multiple other experiences of sexual violence to her kind of various mental health professionals. And this is the fresh evidence that was accessed. So if we could have the next slide, please. Yeah, and the first quote, thanks. So first, all of them, yeah. First in 2014, she saw a university counsellor and discussed one of her prior assaults. The counselling notes are reproduced in the judgment. There's that top one there, where they're quoted as saying, "I took him back to my flat. I didn't say no to begin with, lying attention seeker." The judgment states that the implication of the last phrases is, or maybe, that they were self-descriptions. Now, it's impossible to know whether this was the case, although it does seem unlikely that anyone would describe themselves as lying attention seeker. Anyway, and then there are various other kind of documentations of this woman's prior experiences of sexual violence. So that in that second extract there, the notes read, "Raped 3 times, I put myself in dangerous situations. Number 1, 18 years taken from a bar. I only said no halfway through. Number 2, a guy forced himself on me. Number 3, in Spain, maybe wasn't rape." And then another separate note is written, which I think is the next quote to come through. It says, "Has suffered 3 rapes, putting herself in dangerous situations, brackets, i.e. voluntarily." So you just click for that last quote. Thanks. Well, said it. Anyway, next slide, please. So the judgment interprets all of this evidence as ultimately demonstrating that this woman had a propensity to making false claims of sexual violence. So it concludes that, in our view, this evidence was of a striking nature and relevant as suggestive of previous false accounts. The evidence that the complainant had doubted her in past suggestions of rape and was lying attention seeker should have been admitted. So the conclusion of this judgment is obviously problematic for lots of different reasons. But here I'm only going to speak to some of the points that I'm sort of trying to make with it. So firstly, the discussion of this woman sort of putting herself in dangerous situations, i.e. voluntarily, speaks to the kind of opposite side of the binary notion of insensibility. So where an insensible body testifies to true violation, this woman's body is, again, to use Joanna's words, seductive and either invited abuse or would have been able to repulse any attack. She is the one who's sort of constructed as putting herself in danger and inviting the abuse, failing to resist the attacks because she found it hard to say no. But there is no acknowledgement that it could be true both that she often found herself in these dangerous situations and that the assailants are still responsible for the sexual violence they commit. And yeah, again, this lies in contrast to the kind of earlier discussion of the insensible and frozen body, which is unable to give consent. Second important thing to note about this one was that the original trial actually unusually included video evidence of Gabbai's sexual behavior towards this woman, which demonstrated her clear and explicit non-consent. I'm not going to reproduce any more content from this judgment for you here, but that is quite an important point because it shows you the power of mental health evidence in sexual violence trials if it's able to even overrule video evidence of a crime, which is again pretty unusual in cases like these, as I'm sure you all know. I suppose also one final thing to note about this case is that it doesn't exactly fill us with confidence about the prospect of disclosing experiences of sexual violence to our mental health professionals, given that all of this woman's prior disclosures were then used against her in court and as evidence of false accusations. So, I guess because mental health evidence is so powerful, it's important to understand some of the ways that it can be interpreted in the courtroom, as part of this is about how reliable memories of sexual violence are considered, depending on a person's mental state, should we say. So I'm gonna start with an example of an abnormal mind. So if I have the next slide, please. So Donald Adams had begun an appeal against his convictions for sexual violence, although he actually died before the appeal went ahead again in 2019. At appeal, one of the people who Adams had been convicted of assaulting was deemed manipulative and capable of influencing others to support her allegations. And it was argued that a consensual relationship had begun between them when she was 13 and Adams was 40. In this case, I think this woman may have had a personality disorder diagnosis, but there was either a typo in the transcript or a kind of mistake in the judgment itself, which called her diagnosis dialectic behavior disorder, which, as far as I know, doesn't exist. But if I could have the next quote, please. So the interpretation of this condition is that she had dialectic behavior disorder, a condition which is characterized by taking extreme positions. And if we could have the next quote, actually. The case at the appeal was that the disordered woman, and I quote, was now many years after the event, viewing her past relationship with him through that prism in a distorted way. So the prism being her diagnosis. And to reiterate, this argument was advanced in spite of the fact that Adams was 27 years older than this woman, and that their supposedly consensual relationship had begun when she was 13. This appeal was successful, and Adams was posthumously acquitted. So, I mean, this understanding of the disordered mind as like a prism sort of betrays how the law sees mental health as having a sort of literal direct bearing on perception and memory. Again, to kind of place that in its legal context, the admissibility of evidence of abnormal mental health, as it's called, is related to what's known as the Toohey case from 1975, in which the ability of someone with a mental health problem to kind of accurately perceive events was compared to that of a cataract on vision. And this is kind of directly comparable in this case, where mental health is considered to have a direct bearing on her ability to perceive events in the way of a cataract on vision. She is viewing a past relationship through a prism of distortion, as it says in that quote on the bottom there. In contrast, traumatic memories are considered by law to be more reliable if individuals are literally placed into a state of trauma. And it might be useful to slightly explain why that might be. So can I have the next slide, please? So, thanks. There's generally agreement amongst trauma theorists, I suppose, that traumatic memories are considered pathological. They're encoded wrongly, inaccessible to consciousness apart from in flashbacks and dreams. And this has been described quite well by philosopher Susan Bryson, who, as it says on the screen there, said, "It's accurate because untouched, like an unretouched photo, not worked over or thought about with the distorting categories of cognition. This apparently gives it privileged epistemological status as a bearer of the truth, as that which, for ethical and political reasons, must be preserved." So Bryson's observation here is that traumatic memories are thought to exist in a kind of snapshot form and are more accessible when people are in a state of trauma, perhaps re-experiencing the event as a flashback or a nightmare. And again, that's been very useful and important for understanding people's experiences of trauma. However, in legal policy, this knowledge can instead be used to encourage re-traumatizing victim and survivors. And This can be best illustrated with reference to the current guidance, so it's still in use, on the use of psychological evidence in sexual violence trials. This was published in 2019 as well. And as I say, it's still in effect. So if you could have the next slide, please. It's quite a long quote, so apologies in advance, but yeah. Okay, so research has shown that under ordinary conditions, people with PTSD often have fairly good psychosocial adjustment. However, they do not respond to stress in the same way that other people do. Under pressure, such as at interview or in court, they may act or feel as if they were being traumatized all over again. This high state of arousal may facilitate memory retrieval, and therefore should not necessarily be avoided, although significant explanation and support will be needed. During the attack, the survivor was overpowered and helpless. They need to feel that they have control over their life again. Individuals can be helped if they're allowed to make decisions where possible. Simple techniques such as enabling them to decide if they need a break during testimony can be helpful. This will not only empower them, but will also prevent the compassionate judge rising just at the point when arousal is positively impacting on accessing memories. So literally placing a person back into a state of trauma is deemed to facilitate memory retrieval. And all of these measures suggested in this extract are given to preserve this state to ensure that it is positively impacting on accessing memories. I've also highlighted a couple of other words in the quote because I thought it worth mentioning that this document is quite interesting for its enlisting of sort of feminist language. So to empower the survivor to take control in order to combat their sense of feeling overpowered and helpless. Whereas, yeah, my reading of this is, despite paying lip service to sort of feminist principles of empowerment and agency, the message of this guidance is pretty clear. People are required to, in the words of another judgment, submit to the trauma of giving evidence. So if I could have the next slide, please. Yeah, so ultimately, the main point that I'm trying to make here is that mental health evidence is likely to nearly always be considered relevant to claims of sexual violence. Whether that's in the form of proof of trauma, which is usually demonstrated through a freeze response, or whether there is any suggestion of a kind of mental unreliability. The law sees the mind in a very simplistic way, better at accessing traumatic memories when literally in a state of trauma, and any other mental health problems are considered to have a direct bearing on memory as a prism of distortion, just like a cataract on vision. This is an important point to be made, as it shows that to be successful in the courtroom, people who've experienced sexual violence must demonstrate evidence of trauma, and in fact, a very specific presentation of that trauma. As my wider research shows, that's likely to exclude anyone who had a different psychiatric diagnosis before experiencing sexual violence, as well as those who identify with other diagnoses in the wake of sexual violence. And yeah, I guess on a practical level, if any of you listening are counsellors or mental health professionals of any kind, I would encourage you to be careful perhaps when we're taking notes concerning sexual violence, although I imagine for many of you that's probably standard practice and has been for a long time. But yeah, sorry, that's a bit of a whistle-stop tour, and hopefully if you have any questions, I can explain some of that content in a bit more detail. Yes, and those are the references. Thank you.
Emma, thank you very much for taking us through your research and its key findings. There's a lot there.
Yeah.
I've just popped a reminder in the chat. If people would like to put questions to Emma, please do use the Q&A box and I can work through those. But I guess I wanted to start, Emma, with that. We know that people with mental health problems are at higher risk of sexual violence, and I wondered if you could offer some reflections on how women are more vulnerable to sexual violence as a consequence of mental health problems, and are also their mental health problems are then used against them in their ability to get justice.
Sure. I guess, yeah, there'd be more kind of general reflections really, but yeah, I'd also say that it's not just women, but any kind of mental health service users are more vulnerable or have higher rates of experiencing sexual violence, and that can be due to all kinds of things. So some of the people that I interviewed felt that they had been deliberately targeted on account of their mental health status. So one talked about being known as she called the resident nutcase. And so she felt that she'd been targeted because she knew that no one would believe her if she were to talk about it afterwards. And unsurprisingly, she didn't. So yeah, I mean, again, yeah, there can be all kinds of factors that contribute, and obviously these are somewhat dependent on different diagnoses. So yeah, so for some people as well, just even being like socialized by being in institutions for a large part of your life, and being told to follow certain rules or having certain liberties maybe taken away from you, threatens your ability to then speak out against other people, especially if it happens in some of those settings. So yeah, those are my reflections briefly. So.
Thank you. You mentioned about differences in diagnoses. Did you find differences in how were there differences in how diagnoses were handled within the court system? Did some diagnoses seem to cause particular problems?
Yes, I mean, yeah, no surprise that personality disorders are going to be bad news for people in the courtroom. But it was also, I suppose, also interesting that the kind of, I'd say, not just in the legal cases, but in legal policy, diagnoses that are kind of considered normal responses to sexual violence include obviously PTSD and complex PTSD, but also depression and anxiety and some kind of phobias. But yeah, so I think that's interesting in itself, in just in terms of, I suppose, kind of a wider popular, like in the way that we talk about mental health more generally, I suppose, in society. I'd say that those diagnoses are kind of considered normal or a bit more destigmatized than some of the other ones. Whereas, yeah, I mean, the other ones were any substance use and personality disorders, but nothing else. And often cases would sort of discuss whether someone had complex PTSD or whether they had borderline or emotionally unstable personality disorder. And so it was a toss up between those two. And that's kind of why I tried to present quite a binary talk today, because that's exactly how the law works. It only kind of reasons in binaries. So yeah.
Thank you. One question in the Q&A box which I can deal with, so I'll do that quickly now. So some recommended readings to accompany the topic. So Emma has kindly provided us with a list of references and resources which will be sent to everybody along with the recordings and slides. So if you do want to go further in your reading about the topic, that will be coming to you shortly. A question: has the law changed since last year regarding the admissibility of mental health evidence in court?
Yeah, so the reform that I mentioned is to the Victims and Prisoners Bill, and yes, there's now a test that that lawyers have to sort of meet to show that the mental health evidence would be relevant to the trial. And that's to show that it has probative value to the case. And as I tried to get at there, I think that it won't be very difficult to make that argument. And ultimately, these decisions will be made on a kind of discretionary basis by different judges. So yeah, maybe I'm wrong, and maybe it will make a difference and be helpful. Or yeah, just make some difference would be nice. But it's a fairly subjective test, I suppose. How do you define relevance? And in some other places, it's more clear cut. So in Tasmania, in Australia, if you're part of criminal justice proceedings for an experience of sexual violence, and you talk about that experience in therapy, none of those records are allowed to be used at trial. There's just a blanket exception on all of them. So obviously that's quite a specific set of records, and it wouldn't have saved the person that I discussed in that talk, because she was talking about other experiences of sexual violence. But I still think something like that would be useful, because the things that you talk about in therapy are so different to the way that narratives are constructed for the court. And yes, and as with that person that I discussed, like maybe you do doubt your experiences, or you kind of like feel this sense of responsibility for what happened to you in some kind of way, and you should have space to be able to air those feelings and for it not to then threaten your ability to access justice.
Thank you. A question, is your research available?
Yes. So there's a paper coming out soon that's basically what I've spoken about today, but that's not out yet. But if you just search my name into Google Scholar, I'm sure things will come up. Yeah, so there's one paper out about my PhD, which might be useful. It's not my favorite piece of writing I've ever done, but I still like it.
We will add that to the list of resources that come out. Do you find evidence of the use of mental health, or even just the trauma response, filtering into police investigations for those who disclose to police, and then this impacting the decision on whether to take the case to the CPS?
Yes, yeah, there's a lot of that. So one of the cases that I looked at was some of you may remember the prolific taxi driver rapist John Warboys, and a couple of the women that he assaulted actually took the Met to court for how they handled their reports of his violence. And yeah, basically that was that they'd perceived these women to be kind of like ranting and raving and to be mad or drunk when they'd been drugged for one. But so that was an interesting case. But yes, in short, and there are papers that talk about that as well, like Catherine Hole at City University has written some stuff about that, and Elizabeth Stanko, Betsy Stanko. Yeah.
Thank you. Question, I'd be interested in hearing about whether these understandings and attitudes are reflected in the structure of how the CPS and courts understand sexual violence and mental health versus the understanding and attitudes of individual judges. If it is really about the structure of CPS and courts understanding, is there space for individual judges to deviate in how they, for example, direct the cases in front of them? So what sort of discretion do judges have in the kind of the structures that they're working in?
I suppose that's really a question to the legitimacy of the whole law itself. But I think both can be true. Like, yes, I think ultimately that within the law and within the CPS, there is a very strict understanding of the relationship between sexual violence and mental health, which, as I say, is binary. It's either that someone is manipulative and lying and making it all up, or that someone is legitimately traumatized, and there's not really that much space in between those two things. So then when it comes to a judge's discretion when deciding about relevance, again, they're probably likely to reason it against those two options. And as I tried to show, most mental health evidence then will be kind of interpreted in one of those two ways. So even if it's a diagnosis of depression or a phobia, someone can't leave the house, for example, then that might be considered evidence of trauma and therefore relevant. But yes, pretty much, anything like a diagnosis of a psychosis or a personality disorder is not going to work in your favor. And even things like bipolar or any diagnoses that are sort of, that as part of the symptomatology might include things like hypersexuality, could be difficult to handle in court, is what I'd say. But a judge would probably admit it as relevant to the defense.
Do you know of any similar studies for the asylum and immigration tribunal system? So you've looked at this in relation to the criminal system.
I know of one case, but I don't actually. Basically, in short. Sorry.
Maybe that would be an interesting study for somebody to take forward.
I'll look into it as well.
Just scrolling. Question, how is the re-traumatization of the survivor ethically traded up for a legal outcome? And I suppose extending that, I mean, I think it's horrifying reading that
Yeah.
guidance back. And I wonder if you could offer your reflections and recommendations on how should the trauma of giving evidence be best handled?
Gosh, that's a big question. But in terms of how it's ethically justified, I suppose there are, I mean, it kind of plays into all these different articles of the European Human Rights Convention. So yeah, and also just, I suppose, so one such example would be it would be justified in terms of protecting the public from future harm, would be to try and obtain a conviction for sexual violence, would be to, yeah, protect the public. And so therefore an individual's re-traumatization would be considered kind of short change within that bigger picture. And what did you ask my other reflections on, Sian? Sorry.
About how the trauma of giving evidence
can be handled. It's tricky. I mean, obviously there are all these kind of like measures that have been introduced in recent years that are helpful, like giving evidence from behind the screen or remotely. Yeah, I suppose I can't think of anything off the top of my head. Apart from obviously having support with you, so like having a kind of an independent advocate with you would be nice, like they do in Ireland, so that someone's kind of fighting your corner throughout, rather than watching you submit to the trauma of giving evidence, or whatever it was that judgment said. I think that would help. But I think also really ultimately what would help is trying to challenge these ideas and trying to yeah, get people to think a little bit more in a little bit more of a nuanced way about mental health, and yeah, and again, perhaps to introduce measures that would prevent someone from being re-traumatized, or deliberately anyway.
Thank you. What was my last question? We've got a lot of independent sexual violence advocates on the webinar today, and I wondered if there was any particular recommendations or messages you wanted to give to people who are working in that role.
I guess as you'd always do in that role, and I'm sure you all do, just preparing people for what's about to happen, and like all you can really do is empower people with information, I think, and then they can make informed choices as to how they want to proceed, and so being aware of what kind of things you might have to contend with if you have a diagnosis, or even if you don't have a diagnosis but you sought any kind of mental health support afterwards, just, I guess, yeah, knowing how that's going to be painted in court, and how willing you are to be subjected to that, I suppose, is all I'd really say.
Thank you. We do have questions still in the Q&A box that we haven't had a chance to get, so Emma, I will send those to you.
Great.
If you're able to offer any reflections on them, we can send those out as well. I just wanted to flag it will be coming out in the resources that we're sending, but the Keep Counselling Confidential campaign that has a lot of intersections resonance with what Emma has been talking about today. It's obviously been a really high profile campaign from Rape Crisis, but if it's something that you're not aware of, do look at that. So I just wanted to take the last minute to close to say thank you very much again to Emma for A, for the fantastic work that you've done, and B, for sharing it with us and answering our questions today. It's been great to have you. Thank you very much to all of the people who dialed in to take part in the webinar. If you have come to our webinar not as a VAMHN member, please do go to our website. The link is in the chat there. And you can sign up for our monthly newsletter, which will provide invitations to these events, and also share other resources, training opportunities, funding opportunities. It's a really nice resource. We will be taking a break from the webinar programme over the summer. So if you're looking out for the next one, that will be in September. We are always interested to hear from our members what you would like to hear about. So if there is a topic that you would particularly like us to be addressing in our next webinar series, please do drop us a note to let us know. Other than that, I will say thank you again and wish you all the very best for a very happy summer. Take care, everybody. Bye.
Thank you.